Hi, my name is Alonso Perez, and today we are going to talk about the use of mechanical restraint and patient rights. Violence, aggression, and psychomotor agitation in patients with psychiatric diseases represents a frequent phenomenon, not only in the emergency setting, but also during hospitalization and psychiatric outpatient settings. Agitation is preceded by warning signs. Early detection of these signs will favor a greater probability of success in our intervention. These warning signs are called alarm signs or prodromes, which will serve as early indicators of escalating agitations. These are the highlights: hostile mood, facial tension, restlessness, threatening postures and gestures, increased tone of voice, sudden movements, interpersonal distance decrease, prolonged eye contact, and others. Without the appropriate interventions, some agitated psychiatric impatience may escalate towards aggression and violence. To ensure a safe resolution, it is critical for care providers to effectively interrupt the cycle of aggression before it progresses to violence. As important as knowing the prodromes or warning signs is knowing the cycle of escalating agitation. This knowledge will be essential for us to act on time and properly. The agitation escalation cycle is divided into 7 phases: calm, trigger, agitation, acceleration, peak, de-escalation, and recovery. The types of intervention or management of the patient in agitation escalation are the following: verbal de-escalation, environmental restraint, pharmacological restraint, physical restraint, and finally mechanical restraint. Of the phases of the agitation cycle mentioned above, each one has its specific interventions that will depend on the degree of the agitation of the patient. But we must not forget that the peak phase is the time when there is no type of verbal intervention that can calm the patient's agitation state, which is why only a physical or mechanical intervention, usually supported by medication, will be the way to control the patient's behavior problem. International recommendations in Europe and in United States have called for strategies to be implemented that could reduce the use of restraint and seclusion in psychiatric settings. Legislative changes and new regulations have started to emerge to prevent its use or restrict it only to very extreme situations. But some doubts remain about whether legislative regulations will be enough to eliminate restraint and seclusion in clinical practices. To achieve this purpose, verbal de-escalation has become an essential and frankly useful tool into patient control in the agitation escalation cycle. This technique has been widely developed and used around the world, and its acceptance by health professionals and patients is very favorable. Verbal de-escalation is a way of interrupting the progression of agitation. Is aimed at calmly communicating with an agitated patient in order to understand, manage, and resolve their concerns. These actions should help reduce the patient's agitation and potential for future aggression or violence. Verbal de-escalation is always the first strategy to use in any sign of agitation problems. Sometimes it may not be enough to resolve the psychomotor agitation. However, even if in some cases we could see it does not contribute greatly to the control of the behavior problems, it must always be done and maintained while we apply other restraint measures. Restraint is defined by the US Joint Commission as any method, chemical or physical, of restricting an individual's freedom of movements, physical activity, or normal access to the body. It's a common practice currently permitted for use in mental health, but extremely controversial and poorly evaluated by the appropriate methodology. It is seen as a necessary evil in controlling behavior and preventing violence, thus leading to the normalization of restraint practice. Countries differ in their use of different forms of restraint, with restraints methods used in some of them, but not yet in others. However, in more recent years, there has been an international policy shift to reduce restrictive interventions. Patient seclusion in a locked, government-approved rooms is commonly used to contain violent and/or escalating behavior in inpatient psychiatric settings. But this practice has received critical attention due to its traumatizing effects. The use of these measures have negative consequences for consumers and staff. The most restrictive technique used today in mental health settings, accepted in the vast majority of the countries in the world, is mechanical restraint. Mechanical restraint is a set of techniques utilized to immobilize or reduce the patient's movements to prevent destructive behaviors and preserve safety and integrity of the patient and others. Is an exceptional measure and is considered as last resort, only used when standard procedures have failed. However, it can be the first measure when dealing with a situation of serious agitation or imminent risk. It should be used in the least restrictive way and for the shortest time possible. Nurses have described different negative experiences due to mechanical restraint related incidents such as anguish, guilt, or regret because they felt that they had not done enough to find alternatives to it. Fears for nurses' own safety have been reported because mechanical restraint incidents sometimes trigger angry reactions in inpatients. Positive experience related to mechanical restraint may include relief because of finding the right solution and ensuring safety. They may also increase nurses' safety experience and the sense of cohesiveness of the nursing teams. Several studies conclude that, according to the nurses, alternative methods cannot totally replace the use of mechanical restraint, but all possible alternatives should be used before going ahead with it. Diverse studies show that nurses attribute the following factors as barriers to eliminate the use of mechanical restraint: lack of accessible alternatives for restriction and isolation, adverse interpersonal environment that contributes to the use of mechanical restraint and isolation, unfavorable physical environment that contributes to the aggression and the use of restraints and seclusion. Participants indicated that the practice influenced their decision to the use of restraint and isolation, fear and perception of lack of alternative methods to maintain security. Personnel with less experience or lack of mental health training, and problematic relationships between staff and patients. Knowing the nurses' and patients' feelings related to the use of mechanical restraint studies report, it can be concluded that, among others, the pivotal role of education and training in dealing with agitation patients can reduce or even eliminate the use of mechanical restraint in healthcare settings. In the 19th century, the French writer Gustave Flaubert said, "Life must be a continuous education. The world keeps turning, and the best thing for our personal and professional interest is to bet on continuous training as a way to stay updated and prepared for new circumstances." Lifelong learning, as a whole, is one of the most profitable investments. A person who has access to quality training resources has all the necessary elements for the proper decision making. This requires accessibility, adapt to the training in form, place of provision and periodicity of the growing diversity of needs, development of competence, allowing an autonomous management of the professional trajectory going beyond decision-makings at present moment. We must conceive training as a quality guarantee and a professional development pillar. This is to ensure that society is increasingly competitive and inclusive. It allows us to keep our skills up to date in knowledge, attitudes, and skills. Training for professionals must be flexible, taking into account the needs of individuals as much as the community and the companies. These trainings need to reach all the professionals involved: medical staff, nurses, assistants, sanitary technicians, and others. It is crucial to the personal and professional development of any person due to the impact it generates at different levels. Improves working conditions. The expansion of technical capacities and social skills through training actions position us in a privileged starting situation to access the job market, to promote within the company, or even to get a more satisfactory job. Increase professional competence and productivity. The fact of being highly trained allows us to face decision-making and conflict resolution more effectively, which results in our reputation inside or outside the company, while providing companies with better productivity rates. Increase our job satisfaction. Thanks to training, we will be able to successfully carry out the goals that we set ourselves and face new challenges, which have a positive impact on our work motivation and our personal satisfaction and self-affirmation. Enhance confidence and self-esteem in our personal relationships. Training provides us with knowledge, but also social skills, such as proactive empathy, commitment, self-criticism, tolerance, enabling us to interact with our environment with a more positive attitude. The health field includes a wide branch of specialties and professionals dedicated to the health and well-being of people. It is a commitment to the rest of society and demands from professionals a constant training and specialization process throughout their professional lives. Advances in the health field are continuous. This constant evolution means that health professionals must be up to date and recycle their knowledge. Recycling and training of health professionals is, without a doubt, essential to ensure the progress of this sector and social welfare. It is aimed at improving the quality of the healthcare process and guaranteeing user safety. In cases where mechanical restraint is essential, this must be done with approved devices. My partner Luis will give a brief demonstration of the restraint devices of our sponsored Medicare system. Remember that if you have any doubts or questions, we leave open the opportunity to make any queries or questions that you consider appropriate. We will be pleased to answer them. Thank you for your attention.
Gracias, Alonso. A continuación, vamos a explicarles cuáles son los dispositivos adecuados para efectuar esa inmovilización.
Thank you, Alonso. Next, we will explain the appropriate devices to carry out therapeutic immobilization with controlled mobility as a last option in cases of agitation.
Utilicemos materiales adecuados, materiales diseñados que garanticen la seguridad y el confort del paciente. En este caso tenemos
It is very important that we use safe materials designed to guarantee the well-being and comfort of the patient.
Superiores se refiere, encontramos el dispositivo de muñequera en el que encontramos
In this case, we have Salvafix for wristbands,
el pictograma de cama, una serie de características y la posición. Muy importante la elección de la talla.
As you can see on the label, there is a hand, a bed, and the position.
De la talla para su confort.
It is very important to choose the correct size to provide comfort.
Con ribete de triple cosido, en este caso de color azul, veremos la diferencia con las tobilleras y un acolchado interior.
This device is blue and has interior padding at triple sewn.
Un cierre de velcro que garantiza en todo momento la seguridad y la holgura necesaria para el confort del paciente.
The closest is made of velcro and guarantees the necessary comfort.
Una tira de cierre con un botón de seguridad. Esto permite la movilidad controlada del paciente.
The safety button closes allows controlled patient mobility
o que se retire cualquier periférico en ámbito hospitalario.
And prevents self-injury.
Para retirar este dispositivo de movilidad controlada, mediante una llave de seguridad, podremos retirar la tira de cierre y abrir el velcro.
With the magnetic security key, we can remove the velcro strip.
En el caso de las tobilleras, nos vamos a encontrar la misma estructura, el mismo confort, pero diferente color. Así, Salvafix nos facilita un código de color entre marrón tierra y azul cielo. Azul cielo para la parte superior de las extremidades, marrón tierra para la parte inferior, en este caso las tobillas.
The anklets have the same structure than the wristband. The difference is that the anklet is land brown and the wristband is sky blue for ease of use. On the label you see the foot, the bed and the position.
Procedemos al cierre de velcro. Aseguramos la tira de cierre con el tapón de seguridad y a continuación haremos el anclaje que nos permitirá una mayor o menor restricción proporcional a la necesidad de la agitación que tenga el paciente.
With the safety plug, we can more or less restrict mobility according to the degree of agitation.
Mediante la llave de seguridad.
To open it, we use the security key.
Y la apertura del velcro. Es muy importante el uso de materiales adecuados, especialmente diseñados para utilizar de manera excepcional y solamente en casos que estén realmente justificados. Siempre de
It
manera
is important to use of these devices exceptionally and only in justified cases.
un etiquetado con un pictograma de posición, la talla y además incorpora un código QR.
I present you the abdominal belt that has a labeling with the position, size, and a QR code
Es un cinturón abdominal
to visualize the correct use of the device.
que en este caso incorpora una cinta perineal que constituye un elemento de seguridad pasiva.
The abdominal belt also incorporates a perineal belt as a safety element,
pero que a su vez lo que garantiza es que el paciente, en caso de que se deslice hacia abajo, el cinturón abdominal nunca va a pasar a torácico, produciendo
preventing the sleep of the patient and respiratory complications.
la importancia de la apertura y poder liberar al paciente de manera rápida y sencilla. En casos de emergencia, de baja visibilidad,
In cases of emergency, contingencies, or fire,
en que necesitamos efectuar la descontención del paciente de manera rápida, presentamos esta herramienta de corte. Esta herramienta de corte va a estar centralizada en el control.
the patient can be released quickly with this security key, which must be located in the nursing control.
Apertura con llave, apertura también de emergencia y en su interior tenemos este cúter,
Opening or
esta
even
herramienta de
breaking the glass is a safe and effective cutting tool to ensure patient safety.
Esta herramienta de corte, como decimos, es igual de segura que eficaz. En una contención que encontramos con tensión en un paciente agitado y que tenemos que efectuar una liberación de emergencia, procederemos sin ningún tipo de esfuerzo
We can use it without effort
a la liberación
and easily.
del dispositivo de movilidad controlada. De esta manera garantizamos siempre la seguridad del paciente, que es lo más importante.
To guarantee the security of the patient.
A continuación, vamos a pasar a presentaros un producto nuevo, un producto que va a facilitar muchísimo lo que es el traslado de paciente que presenten cierto grado de agitación, que se llama SalvaFast Transfer.
I present you the SalvaFax Transfer, a new product. You can use it in cases of agitation. SalvaFax Transfer.
SalvaFast Transfer. Encontramos un dispositivo único, monoblock, en el que todos los elementos que conocemos como inmovilizadores, tobilleras, muñequeras, un cinturón abdominal, un arnés torácico,
A single device that incorporates wristband, anklets, abdominal belt, and a chest harness that allows easy and efficient transfer of a patient.
unas asas para facilitar su traslado,
Easy to anchor to the frame, stretcher. Also, it incorporated some handles to facilitate the transfer between surfaces.
Hay que destacar el sistema de triple velcro. En SalvaFast prescindimos de cierres magnéticos.
Its triple Velcro system without magnetic closes stand out.
Utilizando el sistema de ANA, que es azul, negro y azul. Negro.
Using the blue-black-blue system.
Con una resistencia extraordinaria y una confortabilidad superior. Además, la posición del arnés torácico nos permite graduarlo hasta en 3 posiciones.
The position of the thoracic harness allows us to graduate
Voy a
it
pedir la
into
colaboración
3 positions.
de mi compañero. Como hemos comentado, tenemos la posición ya preinstalada para la altura de este usuario. Y a continuación,
First, we will install the different elements of the device at the height of the patient.
de las muñecas se aplica con este triple velcro. Azul, negro.
And then we will apply the triple velcro blue, black, blue system.
Sí, tenemos Ana. Azul, negro y azul. En la contención torácica encontramos un clip de plástico resistente, muy seguro, porque requiere de un tercer punto de presión para efectuar su apertura. ¿Sí?
Then we close the chest harness with clip system.
Las tobilleras tienen el mismo funcionamiento que hemos visto anteriormente. ¿Recordáis? El azul.
The anklets have the same blue, black, blue system.
Esto nos permite trasladar a un paciente con agitación de manera segura y confortable.
This device allows us to transfer a patient with agitation easily and safely. You can learn more on the website about SalvaFax transfer.
Os las responderemos.
Thank you, Alonso and Luis, for your interventions. And now we have some questions from the people. I will read. This is Daniel from Barcelona. He says, congratulations on the webinar. I work in an acute mental health unit. I would like to know if in your ambit of mental health is verbal de-escalation effective?
Hi Daniel, I am very glad you liked the webinar. Of course, it is very effective. Verbal de-escalation is the first strategy that we must use when we detect that the patient initiates an escalation of agitation. It's extremely useful to detect these signs of activation. The sooner we detect and intervene, the greater probability of success or intervention we'll have to avoid increasing the escalation of agitation that requires the use of other restrictive measures.
Now we have a question from Laura. She's from Zaragoza. She says, I work in a mental health care center. In your opinion, Alonso, what should change in our field to reduce the use of mechanical restraints?
Hi Laura, thanks for the question. As I have explained in the presentation, it is not easy as saying to someone, don't perform mechanical restraint, reassure the person with a verbal de-escalation. Institutions must be involved in the desire for change, making the necessary environmental modifications. Equally important as having a staff that wants this change and is adequately trained in these techniques. The desire for institutional staff change is vital to achieve this change in practice.
Now another question. It says, can any healthcare personnel apply SalvaFix on a patient?
No, SalvaFix should only be used by properly trained personnel. Placed without proper preparation jeopardize the patient's health and your own. If you have not received adequate preparation, ask for it in your workplace to contact the Training Institute so that we can prepare a training program adapted to their needs.
So another question I will read. Hi, this is Mar from Karlsruhe. I have heard about verbal de-escalation several times, but I have little knowledge of it. Do you have any reading recommendations, or do you know how I can expand my knowledge on the subject?
Hi Matt, thanks for the question. There are numerous studies that talk about this practice. I personally learned about this practice through the Richmond Project Beta. In it, 10 domains of verbal de-escalation are defined. Approximation techniques are dealing with the patients to de-escalate are perfectly written. In Evo Training Institute, we believe in these techniques, and in our courses, we nurture studies from our experience and studies on the subject, so that they can know how and when the use of verbal escalation is indicated and be placed with its benefits. If you want more information, you can contact us at the end of the webinar and we will inform you about the courses we offer for health personnels related to this technique.
Thank you, Alonso. Another question. After the speech on avoidance of mechanical restraint, a demonstration of how mechanical restraint is done. Why?
Well, in Evo Training Institute, we believe that the inappropriate use of mechanical restraint is something that should disappear from our practice in the healthcare field. Patients and professionals have shown their rejection. Even so, it's a common practice, and this is because it's not too simple to stop using it. As I have commented, there are barriers that make it difficult. Exceptional cases such as intoxications that, although they are not mental pathology, are treated in hospital, and that we live under the legal protection that this practice allows. For this reason, that mechanical restraint is something that is done. Our partner medical system has asked us to do a demonstration with their material. They are very aware of this trend and adhere to our philosophy. Mechanical restraint should be a technique that is done with the greatest possible safety, without forgetting the dignity of the people, that is used as little time as possible, and making use of the material of restriction gradually, from less to more depending on the intensity of the agitation.
Thank you, Alonso, for your answers. If you have more questions, please let us your comments and we will be back to you as soon as possible. Thank you very much for your attention and have a nice day. Bye-bye.